Hand washing, hand scrub. Purposes: to reduce the number of microorganisms on the hands, to reduce the risk of transmission of microorganisms to clients, to reduce the risk of cross-contamination among clients, to reduce the risk of transmission of infectious organisms to oneself. Assessment: determine the client's presence of factors increasing susceptibility to infection and possibility of undiagnosed infection, use of immunosuppressive medication, recent diagnostic procedures or treatments that penetrated the skin or body cavity, current nutritional status, planning, the location of running water and soap or soap substitutes, assemble equipment, soap, warm running water, disposable or sanitized towels or paper towel, implementation, preparation, assess the hands, nails should be kept short, remove all jewelry, check the hands for breaks in the skin, such as hangnails or cuts. Performance: if you are washing your hands where the client can observe you, introduce yourself and explain to the client what you are going to do and why is it necessary. Turn on the water and be sure to adjust flow so that water is warm. There are 5 common types of faucet controls: hand-operated handles, knee levers, foot pedals, elbow controls. Move this with elbow instead of hands. Infrared control. Motion in front of the sensor causes water to start and stop flowing automatically. Wet the hands and wrists thoroughly by holding them under the running water. Hold the hands lower than the elbow so that the water flows from the arm to the fingertips. Apply soap to the hands. If the soap is liquid, apply 4 to 5 milliliters. If it is bar soap, granules, or sheets, rub them firmly between the hands. Thoroughly wash and rinse hands. Use firm rubbing and circular movement to wash the palm, back, and wrist of each hand. Be sure to include the heel of the hand. Interlace the fingers and thumbs and move the hands back and forth. The World Health Organization recommends these steps. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms with finger interlap. Rotational rubbing of left thumb clasped in right palm and vice versa. Continue this motion for at least 30 seconds. Rub the fingertip against the palm of the opposite hand. Rinse hands. Thoroughly pat dry the arms and dry hands and arms thoroughly with a paper towel or clean hand towel without scrubbing. Discard the paper towel in the appropriate container. Turn off the water. Use a new paper towel to grasp a hand-operated faucet. Variation: hand washing before sterile skills. Wet the scrub brush and apply a liberal amount of antimicrobial soap into your hands. And lather well to 2 inches above the elbow. But hold the hands higher than the elbow during this hand wash. Let water run from the fingertips to the elbow so that the hands become cleaner than the elbows. Using a circular motion, scrub all the surfaces of one hand and arm. Start at the fingers. Scrub at least 10 strokes each on nail, all sides of fingers and both sides of hands.
And drop the stare down back.
Scrub the arms using 10 strokes each of the lower, middle, and upper areas of the forearm. Keep arms higher than the elbows. Rinse the surgical brush and reapply antimicrobial soap. Repeat the scrub on the second hand and arm. Normally, the scrub takes at least 2 to 6 minutes. After washing and rinsing, use a towel to dry one hand thoroughly in a rotating motion from the fingers to the elbow. Use a new towel to dry the other hand and arm. Apply sterile gloves before touching any sterile items. Ensure that both hands are clean and dry properly.